Pregnancy in newborns. Andre Santos, Michaela Lopez, Alan Nguyen, Rufino Echanis, and Wendy Luna.
Conception and implantation. The sperm cell comes into contact with the female egg and they combine into one cell, a process called conception. The fertilized egg then gradually moves along to the uterus where it clamps onto its wall. The father determines the sex of a baby. The father gives either an X or a Y chromosome, which makes a chromosome pair, double X for female, XY for male.
Moving on to the first trimester. The first trimester focuses on the development of the fetus, or in other words, embryo. The reason I use both terms is because the embryo is not considered a fetus until the 10th week. Throughout the process, we could see that in the 3rd week, the nervous system begins to form. In the 4th week, the heart begins to beat. In the 5th week, the head continues to grow rapidly. In the 8th week, almost all the body parts are differentiated, which means that you can see where the head is, where the toes are, and feet, the hands, all of the above. On the 12th week, the formation of red blood cells begin to slow down. Now you may ask, where are all the other weeks that are not mentioned? The reason the 7th week, the 6th week are not mentioned is because the process of the fetus is still developing, but it's not a major component of it. Now, there's 2 things to keep in mind during the first trimester is that during the 2nd to 8th week, the fetus is very sensitive, which means that there could be a major risk in the pregnancy if there's a defect in it. And also, teratogen is most sensitive at the beginning. However, as weeks are processed, it becomes more stronger and the baby could be healthier.
The second trimester is between 13 to 27 weeks, and what happens during this time is that the fetus is more active and developed, meaning that most joints and bones have started to form. The fetus breathes amniotic fluid, which helps strengthen the lungs, and it also gets lanugo, which is body hair that covers the skin and helps protect it. The gender can be seen between 18 to 20 weeks, which is also around the time that the mother will feel the first fetal movement.
During the 3rd trimester of development, the fetus grows in size and begins to get ready for birth. The fetus is usually around 6 to 9 pounds and 19 to 21 inches long, but this may vary depending on factors such as mother's diet, cultural background, or genetics. The fetus appearance is more prominent. The skin is more pink and smooth, eyelashes and eyebrows develop, toenails and fingernails form, and hair grows as well. Movement during this period is usual and common. The fetus moves around the room, kicking and stretching. The brain rapidly develops, allowing the fetus to respond to sound, pain, and light. The fetus can hear its mother's voice and other outside voices. The fetus can distinguish familiar words and prefers its mother's voice rather than other voices. Bones of the fetus strengthen, although the skull is still soft, so that the fetus can pass through the birth canal easier. Now, the fetus in the womb should be upside down, ready for birth.
Newborns. Birth to 28 days. WHO. Newborns are defined at the age range from birth to around 28 days, according to the World Health Organization, WHO. At this stage, the newborn is very vulnerable to outside dangers, such as SIDS or sudden infant death. Babies are starting to learn to live in the outside world. Eyes can track objects with less eye crossing, can grip objects and bring hands to their mouth, and will be able to smile later on.